Good morning, everyone, and welcome to Using the CDC's Essentials for Childhood Framework to Promote Great Childhoods for All, presented by J. Bart Klicka, Chief Research and Strategy Officer of Prevent Child Abuse America. My name is Rick Hugg. I'm a retired IU Northwest faculty member, and I'm here with Catherine Malone, who will be a moderator. Catherine's a family case manager supervisor at the Indiana Department of Child Services, Lake County office. We are delighted today to have Bart with the presentation. It is the fifth and final workshop in our 2020 IUN Forum on Child Abuse and Neglect webinar series. Let me just say a little bit about the planning committee. We really would like to encourage and we wish to recognize that some of our participants who have survived and continue to work through trauma in their lives, we understand that some of this content might very well elicit some personal reactions, and we encourage you to engage in self-care and professionally trained support. Now it's my pleasure to introduce Bart Klicka. Prevent Child Abuse America is in Chicago, so Bart is our neighbor, lives not too far from us. And besides being the Chief Strategy Officer and research person at the Prevent Child Abuse in America, he is also a research faculty member at Florida State University. He's a former assistant professor of social work at the University of Montana, and his research agenda is the causes and consequences of child abuse and neglect, with a view to dealing with prevention matters. Currently, he's the principal investigator on his research study of the research of the effects of paid family leave and child care on preventing various types of violence against children. He has a number of consultancies. The primary one is with the U.S. Center for Disease Control, the CDC. He has a number of projects there that he's worked on with them on prevention. Finally, he was a winner of the Doris Duke Fellowship for the Promotion of Child Well-Being. He was a member of the individual cohort in 2011 of the Doris Duke Fellowship. It's a fellowship for doctoral students who are interested in prevention of child abuse and neglect. He is a board member of the American Professional Society on the Abuse of Children, which is the premier child abuse professional society, APSAC, and he is chair of APSAC's Prevention and Publications Committees. He is also the senior editor of the APSAC Handbook on Child Maltreatment, 4th edition, and is an associate editor of the Journal of Interpersonal Violence. It is now my pleasure to introduce to you Bart Klicka. Welcome to the IUN Forum.
Thank you, everyone. I want to say thank you to the planning committee for inviting me to be here today. I have to say, I've never seen such an organized group of folks. The communication about this event was incredible, as well as their preparation for today. So I want to say thank you to the planning committee. So as they mentioned, my name is Bart Klicka. I'm the Chief Research and Strategy Officer for the national organization Prevent Child Abuse America, and I'm your neighbor to the west. We were joking this morning that I'm only, probably about 10 or 15 miles from Gary, and so know the area well. I've been at Prevent Child Abuse America for about 3 years, and our organization, briefly, we've been around since about 1972, and our primary mission is the prevention of child abuse and neglect. So working upstream, so to speak, to make sure that no kids, no families, and no communities experience abuse and neglect. And we do our work in a number of ways. First of all, we operate the evidence-based home visiting program, Healthy Families America. I know a number of folks on this call are familiar with Healthy Families. We've got nearly 600 sites across the country delivering services to kids and families. We also do work at the federal level on policy. I'm going to talk a bit today about some of the work we've done on policy, but really ensuring that we have the federal support for community-based primary prevention, home visiting support, and all the other types of services that we know that work to prevent child abuse and neglect and address many of the conditions and contexts that create family stress. We also do work around public awareness. You likely have seen in the month of April, Child Abuse Prevention Month, our pinwheel. I've always got my lapel pin on. We're pinwheels for prevention. This is our symbol of great childhoods. And it's part of the way that we work to really increase awareness about our issue. And last but not least, we support a 50 chapter state network. We have chapters of our organization in all 50 states, or at any one point in time in nearly all 50 states. And it's really our state chapter network that is doing the on the ground work, working on advocacy, working on programming, ensuring that we have robust prevention systems at a state level. Where I sit in the organization, I do a lot around research and evaluation, both on conducting research for the field, but also thinking about how to evaluate many of the programs that we have internally. And since joining the organization just slightly over a year ago, our president and CEO, Dr. Melissa Merica, has really emphasized the fact that prevention happens in partnership. No one organization, entity is going to prevent child abuse and neglect on its own. We need each other. We need to leverage our strengths. And so we work very strategically on trying to partner with others who work in this space to ensure that we change the conditions and context to support thriving families. So plan for today. In the next little over an hour or so, I'm going to try to cover the history, the present, of child abuse and neglect, really focusing in on the CDC's Essentials for Childhood framework and how that's guiding the field right now with a lot of the policies and strategies that we're implementing. And then at the end, just suggesting a few directions where I think that we as a field can move. But to start, I really want to frame what I mean when I talk about prevention. Now, when I was in Montana or on the West Coast and we actually had hills and mountains, this made a lot more sense. But since you all are from the Midwest, imagine we're standing on a beautiful overpass here in the Midwest. And the problem with this overpass is that we have beautiful views, but people continue to fall off. So as a community, we could come together and develop a solution to this problem. The first solution we could come up with is we could say, well, why don't we just put ambulances at the bottom of this overpass? And when people fall up, we can patch them up and get them on their way. This is what we often think of as tertiary prevention. This is where I got my start in the field, working community-based foster and adoptive care, working with families who have already experienced abuse and neglect. You're working to stop the abuse, minimize the consequences, and get them on their way. A second strategy is we could say, well, what if we put up safety nets to catch people as they were falling off of this overpass? This is what we think of as secondary prevention. In our area, this is oftentimes working with individuals, with families, with communities that otherwise demonstrate some level of risk for child maltreatment, but otherwise don't have child maltreatment happening. And then finally, we could develop a system by actually putting a fence at the top of this overpass and stop people from falling off in the first place. This is what we think of as primary prevention, putting fences at the top of the cliff or at the top of the overpass to make sure that people never experience abuse and neglect in the first place. In our line of work, we often think of programs and strategies that are delivered universally to all individuals within a community to make sure that no family or child experiences abuse. One clarification that I like to make, because sometimes people say, so what you're saying is secondary is better than tertiary and primary is better than secondary, and that's not the case. I think if we are going to develop a true system of prevention in our states, in our communities, and even nationally, we need robust systems of primary, secondary, and tertiary prevention that are coordinated, that are available, and that are communicating about what's going on in a community to make sure that we have services across the continuum for families. So briefly, I hope that the historians in the crowd don't throw virtual tomatoes at me because I'm skipping over a lot here. But just to give us a flavor of our historical response to the issue of child abuse and neglect. We think about going back to the 1800s, and we see the settlement houses, and specifically Hull House here in Chicago, that really recognize the idea that solutions are embedded within community. That if we want to address an issue, we need to be embedded within the community. We need people with lived expertise giving input and actually running many of these services. Over time, we saw a shift into the 1920s. We had the creation of the Children's Bureau around 1912, the Shepard-Towner Act in 1920, which really was one of the first federal investments in universal access to prenatal and infant care and education. The more I talk today, the more you're going to hear me using this term universal. Universal mean that it's available to everyone. It's not based upon some marker of risk. But as we saw through history, we saw the expansion of services with the Social Security Act in the 1930s. And it's at this point, however, that we started to see services shifting from that universal delivery to more targeted services. So targeting towards individuals, families, and communities where there otherwise is some demonstrable risk. Fast forwarding a bit, we get to the 1960s, which, as we think about the field of child abuse and neglect, we think of Dr. Henry Kemp, a pediatrician who in the early 1960s with some colleagues authored a piece called The Battered Child Syndrome. Dr. Kemp was noticing in his practice and nationally through some survey work through district attorney offices that kids were coming to pediatric clinics with unexplained broken bones, with bruises that were otherwise caused by parents being violent with them. And so he wrote this seminal article called The Battered Child Syndrome, and really is credited with being sort of the father of the field to really raise professional awareness about this problem of child abuse and neglect. It's Henry Kemp who is largely credited with the creation and the passage of CAPTA, the Child Abuse Prevention and Treatment Act, in the 1970s, the creation of our modern day surveillance system, and in partnership with Ray Helfer, really was instrumental in the creation of our children's trust funds at the state level. These are dedicated funds at a state level that are earmarked specifically for the prevention of child abuse and neglect. So as I said, it's really the work of Dr. Henry Kemp that put into place a surveillance system for child abuse and neglect. And by surveillance, I mean a system to track child abuse and neglect at a state level. Many folks on this call likely know that we get our national estimates through the National Child Abuse and Neglect Data System, or NCANS. NCANS collects data from all of the states about child abuse and neglect and compiles them into our national estimates. Now, a note of caution, every state has the opportunity to define child abuse and neglect in different ways. We know that individual state level child welfare practices on substantiation, approaches like differential response, these all can affect rates of child abuse and neglect at a state level. So I always like to exercise caution for people when you start looking at some of your state level data and making comparisons among states, because we're not always comparing apples to apples. But nonetheless, these are our federal data that suggest something about the scope of the problem. Our most recent data come from 2018, and it suggests that approximately 678,000 children were determined through official investigation to be victims of child abuse and neglect. What I point out here that is sometimes surprising to audiences is that anywhere over the years, as we've tracked it, anywhere from 2/3 to 3/4 of the cases of substantiated child abuse and neglect are actually child neglect, which sometimes can be surprising to people. If everyone looks under their chair, I provided you with a magnifying glass so you could actually read these. Rick actually provided me with the link to some of the child trends data And I just provide this for your leisurely reading. It compares some of Indiana's data, looking at child welfare referrals, investigations, victims of child maltreatment, including things like post-service response. Now, what these figures do is they do compare Indiana to the US totals and prevalence rates. But as I said, I would exercise caution when you're drawing comparisons between states and looking at prevalence of things because of many of the things that I had noted in the previous slide. Over the past 30 years or so, Dr. David Finkelhor has been using some of the NCAN's data to track trends in child abuse and neglect. So trying to understand what's happening over time. What he suggests is that over time, we've seen these declines in child physical abuse and child sexual abuse. However, we have not seen the same trend in declines with child neglect. Now, there's a lot of discussion that goes on about these. Are these true declines, or are they the result of potential practice or policy decisions that went in place within child welfare? But one thing is clear is that we don't see the same trend with child neglect, which suggests that for whatever reason, child neglect is not responding to our interventions in the same way that child physical abuse and child sexual abuse are. Some have even suggested that because neglect is so intertwined with poverty, and we have yet to develop a real strategy for addressing poverty, that may explain why we haven't seen rates of child neglect declining. We've used over time some of this surveillance data to try to put an estimate on how much does this problem cost us. When we're on the Hill in DC, when we're talking to state folks, everyone wants to know, how much does child abuse and neglect cost? Researchers from the Centers for Disease Control and Prevention estimate that each victim of child abuse and neglect will incur costs of nearly $830,000 over their lifetime. Now, it's important to note this is not an annual cost. These are not receipts for services. These are estimates of what it costs an individual victim of child abuse and neglect in services such as child welfare, juvenile justice, special education, as well as areas like productivity losses later in life. Earlier this year, we did some work and wrote a paper looking at taking some of that surveillance data, taking this economic burden data and saying, okay, what's the economic burden of child maltreatment across each of the states? Here, I pulled out data specifically for Indiana. And what these data suggest is that if we look at cases of child abuse and neglect, so those who were investigated plus child deaths, just for the cases that occurred in 2018, just that cohort of children over their life will incur costs of nearly $135 billion. It's these types of findings that we've used to really advocate for increased funding for child abuse prevention. We've seen estimates come out of places like Child Trends about federal, state, and local spending on child welfare, and it's in the billions of dollars annually. Yet when we look at the federal investment in child abuse prevention, we're only in the millions. We have a lot of work to do to try to flip the proportion of funding that goes to upstream prevention so we can avoid many of these downstream costly consequences of abuse and neglect. So early on, we started seeing in the field people talking about this problem of child neglect. What's going on with child neglect? So in the early 1980s, we saw people starting to write about this problem. Howard Dubowitz talked about this idea over time about the neglect of neglect. You know, he came in the 1990s and said, you know, it was early 80s we started talking about this. We're not seeing any trends changing. We need to stop neglecting neglect. However, this continued on, and I would argue even continues on today, that when we look at our child welfare caseloads, anywhere from 2/3 to 3/4 of cases are child neglect. We know that when you look at the families who are referred to child welfare, we know that so many families are struggling with housing, food insecurity, unemployment. Yet we don't have a universal system of access and support for families. So child welfare really becomes the sole intervention for bringing families in to try to give them support. And as a field, we need to understand what family needs are, and we need to build a system of care and support so families who have otherwise needs for things like housing, food, employment aren't having to enter the child welfare system. We've seen interventions that have been developed specifically for child neglect. So the Safe Environment for Every Kids, or the SEEK model. This is work from Howard Dubowitz, or Dr. Bob Segi, who has worked on Project Dulce. These are all pediatric, medically based interventions that really work on supporting kids and families, addressing family needs as a holistic issue, not just dealing with the medical issues presenting to kids and families, but really trying to address the context in which kids and families live. We've seen over time as well, not just pediatric interventions, but also home visiting. In the late 1980s, the U.S. Advisory Board on Child Abuse and Neglect came out with a number of recommendations for stemming the tide of child abuse and neglect. And one of their recommendations that came out was around home visiting. What they said is that universal home visitation was perhaps one of the most promising strategies that we had in stemming the tide of child abuse and neglect. On the other side of the screen, you'll see an article that was published last year by Dr. Deborah Darrow, who's been a strong advocate for continuing on this call for our need for a universal system of care and support for children and families. From the 1989 recommendation from the U.S. Advisory Board on Child Abuse and Neglect till today, we still do not have a universal system of home visiting and or universal support for kids and families in this country. And I will come back to this a little bit in my comments at the end. Then we've got the issue of child sexual abuse prevention. As a field, if you're like me, the early days when I'm thinking back to my 5th grade classroom when I was taught these messages about child sexual abuse, that child sexual abuse oftentimes happened at the hands of a stranger, situations of abduction where someone was going to try to lure you into a windowless van using candy. And so these were some of the early messages that were used to talk about the issue of child sexual abuse. But over time, we've learned a number of things. One of the things we've learned is that many, if not most, cases of child sexual abuse occur at the hands of someone that the family knows, be that a family member, a trusted member of the community. We also know that with child sexual abuse, it is pervasive in many youth-serving organizations and sporting organizations, and in contexts where there is positions of potential power and moral authority. We see that it's happened in congregations across the country. And more recently, there's been a lot of discussion about online sexual abuse and the issue of online child sexual abuse. There was a series put out by the New York Times last year that really took on this issue of online child sexual abuse and the many images that were recovered. And what they say is, of the images that they recovered, it was nearly 45 million images that they recovered. And when you think about online child sexual abuse, there's the actual act where the child was sexually abused, but the re-victimization that occurs every single time that one of those images is shared or any one of those images is viewed. And so there have been efforts at the federal level, competing bills that have tried to tackle this issue of child sexual abuse online. And so we're hopeful in the coming years that we're going to see much more investment federally and even hopefully at a state level on really addressing this significant problem. Historically, we've seen our solution to child sexual abuse, as I said earlier, in the 5th grade, I remember receiving kind of the training in schools, the good touch, bad touch, go run and tell someone if something happens. And we've looked at, or others have looked at, some of the science on these school-based education programs. And in general, we find that it increases things like kids' knowledge about what to do if they're concerned or if something has actually occurred. But some of the findings about disclosure, whether or not these programs actually increase disclosure, some of the findings are mixed. There have been a number of calls for saying, you know what, our sole solution to the prevention of child sexual abuse cannot place the burden of child protection on the kids. And so some people say that if we only have a strategy that is teaching children to protect themselves, to go run and tell if something has happened, we're placing the onus on them. And so advocates have suggested that in addition to these school-based programs, we also need adults and communities to take responsibility for the protection of kids. And so we need to develop programs that actually communicate and train individuals at a community level on what they can do to protect kids. One of those programs is Darkness to Light, Stewards of Children, which really takes on this stance that child sexual abuse prevention is an adult responsibility. They've done some work to evaluate programs like Stewards of Children. They've done some implementation studies. And that what they found is that in communities where they have wide-scale implementation of Stewards of Children, they actually see increased allegations for child abuse and neglect, which suggests that the training is actually raising awareness of the problem and likely helping people understand what it is that they can do to actually report. The Centers for Disease Control and Prevention in 2007 put out a document on preventing child sexual abuse within youth-serving organizations, which provided a series of recommendations on what youth-serving organizations could put into place as far as policies and practices to ensure that we minimize the opportunities for child sexual abuse to happen. Currently, the CDC is working to revise those guidelines. I'm fortunate enough to serve on the review committee that's providing recommendations for the update. 2 weeks ago, we met for the first time. This project's going to take a couple of years, but we're excited to actually think about updating these guidelines and disseminating new guidelines to youth-serving organizations to make sure that we're protecting children from sexual abuse. Within our field, we've also tackled the issue of corporal punishment or spanking. This has been a hotbed topic, I know, in many states. There's still approximately 16 to 19 states across the country that allow spanking in public schools. Some researchers have done some work over the last couple of years trying to understand what does the science tell us about spanking. Dr. Liz Gershoff has really been leading many of those efforts and did this large-scale meta-analysis, which really pulls together the findings of the literature that we already have out there. And she really drew two conclusions from this work. First of all, that spanking is associated with negative outcomes, so things like aggression and mental health problems. And that when they compare outcomes for kids who are physically abused to those who are spanked, what they largely find is that there's no difference in outcomes. Both groups are experiencing negative outcomes. And so it's findings like this that have really pushed organizations like the American Academy of Pediatrics to come out fairly strongly against the use of spanking and corporal punishment. I believe it was 2 years ago the AAP released their new policy position statement, taking a much stronger stance on not recommending the use of spanking and corporal punishment. Other work has been done suggesting that spanking and corporal punishment should be viewed as an adverse childhood experience. In this study, what the authors did is they looked at outcomes associated with different forms of early adversity. And what they found is spanking was uniquely associated to a number of negative outcomes. So again, it's findings like this that are building the evidence around moving away from the use of spanking and physical discipline. One of the strategies that's currently being advocated is the use of no-hit zones. No-hit zones really are a universal policy that organizations and institutions implement to suggest that they're a hit-free zone, that parents won't hit parents, parents won't hit kids, kids won't hit parents. And the goal is to really change the social norm around the acceptability of corporal punishment and spanking. Early intervention of no-hit zones, they've worked to evaluate some of this. There's some other work currently being done to evaluate no-hit zones. What they found is that the implementation in medical setting, when they implemented no-hit zones, that staff generally at the end held more negative attitudes towards spanking and positive attitudes towards feeling comfortable to intervene if they actually saw a case of corporal punishment or spanking. So it's these types of interventions that have been put in place to try to change the societal norm around corporal punishment and spanking. You know, like I said, there's still 16 to 19 states that allow corporal punishment in schools. Recently, there was a bill being circulated around about actually doing a federal ban on corporal punishment in schools. And I think as we move forward, there's been a lot of calls for banning corporal punishment in households across the country. I think this is going to take a long time to potentially happen. And that as a field, we need to think very carefully about what that means and many of the unintended consequences that can occur through policies and bans. What we want to make sure is that kids are protected, that they're provided optimal development, but we also need to make sure that we're not disproportionately finding a new way to track families, specifically families of color, either into child welfare, juvenile justice, or criminal justice systems. This is a very complicated issue. We need to make sure that we're having in-depth conversations about the implications of banning things like corporal punishment. But what we're using is the science, and the science says that spanking children is not helpful for their development. So we need to develop new strategies and work with kids and families to ensure that we're implementing these supportive strategies. Next is the topic that we've covered as a field, the idea of abusive head trauma or shaken baby. One of the most widely implemented programs across the country is the period of purple crying. It's a universal strategy implemented in a hospital setting where families get a brief intervention shortly after the birth of a child, helping them understand something about that period of unconsolable crying that so many children go through. I know as a parent of two lovely daughters that both of them went through periods where they just cried and cried and cried. And so this program really helps families understand this period of inconsolable crying. And there's been evaluations of these types of interventions. One in the state of North Carolina was a statewide implementation of the period of purple crying. And what they found was that there were no effects on statewide levels of abusive head trauma. However, they did see reductions in nurse line calls related to infant crying. Now, when you look up north, we've seen the implementation of the period of purple crying in places like British Columbia, where they did a province-wide implementation of the period of purple crying, and they did see reductions in hospital admissions for abusive head trauma. And so some of the findings are mixed when it comes to programs like the period of purple crying, but we continue to look for ways to getting to families early, providing them with light touch education moments specifically around the perinatal period, that is just before or just after the birth of a child, because we find that this is the most critical time as we think about prevention efforts. And then finally, as a field, we've also tackled this issue of psychological maltreatment or emotional abuse. I had the fortunate opportunity, although it seems eons ago, to actually be with many folks in Indiana, where we held an international summit on the topic of psychological maltreatment, led by a number of the leading experts in the field, Stuart Hart, Marla Broussard, who have been working in this area for so long. The American Professional Society on the Abuse of Children, or APSAC, with whom I sit on their national board of directors, has really been advancing this topic about our understanding of what is psychological maltreatment, how do we detect it, and how do we train professional workforces to actually recognize and intervene if they suspect psychological maltreatment. So shifting a bit from some of the topics and strategies, thinking to policy and funding streams as it relates to our work in the field of child abuse and neglect. I had mentioned earlier CAPTA, the Child Abuse Prevention and Treatment Act, which provides federal support for much of the community-based prevention work that is done at a state level. We also recently saw the passage of the Families First Prevention Services and Treatment Act, FFPSA, which really shifted and changed. It represented a landmark shift in how Title IV funds can be spent, and really looking for states to find ways to prevent entry of children into the foster care system. From a prevention standpoint, we want to applaud the work that's been done with FFPSA. We think it's a great stride forward, but we also want to continue to push the envelope and say, you know, preventing entry into foster care is not necessarily the types of primary prevention strategies that we know that kids, families, and communities need to ensure they have all the resources and supports they need to prevent abuse and neglect. We've seen over the years the implementation of the Maternal, Infant, and Early Childhood Home Visiting Program, or MCV, which supports many of our evidence-based and promising home visiting models at a state level. We're hoping that MCV starts to get more federal and state support. MCV has been reauthorized, but we're always finding ourselves in some period of reauthorization. But it's this funding that really supports much of that early intervention home visiting support that so many families and communities need. And then finally, I put down here Aaron's Law. This is just a representation for many of the states that have implemented policies, whether it's suggestions or mandates for providing training and education to children in schools around child sexual abuse, the signs, the symptoms. And so advocate Aaron Marin has been going around the country working with states to implement Aaron's Law. There are many others, Tara's Law, Jenna's Law. Many of these laws are working to ensure that states make a commitment to providing training and education in school settings. It's important to note that there's extreme variability in how these laws are implemented across states. Many of them are put into place as unfunded mandates. As many of you know, when a policy is put on the books but does not otherwise have funding attached to it, it creates many implementation barriers, and it leaves concerns about whether or not we're providing the highest quality services that we otherwise need to be providing. So I don't know that nowadays I could do a presentation without talking about the Adverse Childhood Experiences Study, or the ACEs study. The ACEs study has provided the field with a framework for understanding the accumulation of trauma and adversity that is so pervasive for so many families and individuals across the country, and how many of these early experiences are related to some of the leading causes of death and disease and disability in this country. The early findings of the ACEs study suggested that for those compared to those with no ACEs, those with 4 or more ACEs were at increased risk for everything that you see here on the screen. Again, it's these types of findings that have allowed us to go to the Hill to advocate for more prevention dollars to be able to implement the types of primary prevention strategies that we need. Some people have critiqued the original ACEs study and said, you know what, this was a study done in California. It was largely a white, older, insured sample. Do these findings really stand when we look at it from a state perspective? Our president and CEO, Dr. Melissa Merrick, before joining us at Prevent Child Abuse America, led the adverse childhood experiences work at the Centers for Disease Control and Prevention, and was really leading some of the efforts to look at the behavioral risk factor surveillance system data, BRFIS data, at a state level to understand a couple things, both the distribution of ACEs across the country, and what they found largely is that, yes, the findings of the ACEs study mirror what's happening at a state level. The second thing that they've been able to track is, do early adversities associate with later problems and complications in life? And lo and behold, when we look at data across states, we find that same message, that early trauma and adversity is associated with some of the leading causes of death and disability, including things like economic opportunities and life experiences for individuals. Some of the work that Dr. Melissa Merrick led really looked at, what if we were to prevent ACEs? If we were, as a country, to prevent ACEs, what would that look like for some of the health conditions, disease, and disability that we see across the country? And what these findings suggest from the analysis that she led was that if we could prevent ACEs, we could prevent up to nearly 44% of depression, nearly 24% of things like asthma, 13% of coronary disease. What some of these translate into is, that's 21 million cases of depression, 1.9 million cases of heart disease if we were to prevent child abuse and neglect. Again, it's these types of findings that help really make a case for why it is that we need to move upstream and prevent trauma and adversity. But adversity is not everything, as we know, that it only tells one side of the story. Dr. Bob Sagi, for the last number of years, has been advocating that in addition to understanding trauma and adversity, we also need to understand the experiences that children and families have in their lives that put them on a trajectory or otherwise buffer the risks that they experience in life. He terms this healthy outcomes of positive experiences, or HOPE. Now, not all of us are as lucky as Dr. Sagi to come up with such a great acronym, but it's really been this work that has pushed the envelope in the ACEs spheres to say, we can't just understand stuff about trauma and adversity, we also have to understand something about positive experiences. In some of Dr. Sagi's work, he looked at, kind of like they did in the ACEs study, the accumulation of positive childhood experiences. And when compared to individuals with self-reported very few positive childhood experiences, those with 6 to 7 positive childhood experiences in their life were reporting significantly less depression and mental health problems later on in life. So the more positive childhood experiences you have in your childhood, the less depression, the less mental health problem you were having later on in life. The takeaway from this graphic from his work is this: even for those individuals who were experiencing 4 or more adversities, if they simultaneously in childhood had caring adults, had a community that was otherwise supportive of them, despite the trauma and adversity that they were going through in their lives, if they had more positive childhood experiences, those experiences buffered the experiences of risk. And we saw that compared to individuals with fewer positive childhood experiences, even in the context of significant risk, those with more positive childhood experiences were experiencing less depression and less mental health problems. And so we see the powerful buffering role of positive childhood experiences, even in the context of significant adversity. So the CDC over the years really has tried to articulate what their vision is for the prevention of child abuse and neglect. Early on, worked with the CDC around 2008, actually had the fortunate opportunity of working with Dr. Melissa Merrick when she was a program officer at the CDC, leading much of this work. But the CDC really said, you know, if we're going to prevent child abuse and neglect, we need to articulate a vision for what we want for all kids and for all families. So they developed a vision around safe, stable, nurturing relationships and environments for all children. In order to achieve safe, stable, nurturing relationships and environments for all children, they developed what's called the Essentials for Childhood framework. The Essentials for Childhood framework is just that, a framework to organize states and local communities on how to organize activities, how to gain momentum, utilize research, and implement best practices to support the types of policy and practice changes that are going to promote safe, stable, nurturing relationships and environments. And then finally, to support the implementation of the Essentials for Childhood framework, they did a comprehensive review of the research evidence and put together what they called the technical package for policy, norm, and programmatic activities, which really reviews what does the science tell us about the best ways to prevent child abuse and neglect. And so this is where we go to consult the evidence, to implement the strategies that are in the Essentials for Childhood framework, which then helps us achieve the vision of safe, stable, nurturing relationships and environments for all kids. So I'm going to take a minute and kind of walk through the safe, stable, nurturing relationships and environments framework, as well as the Essentials for Childhood framework. So when they talk about safety, they talk about safety both in the context of relationships, but also environments. In order for kids to thrive, they need to know that they have relationships where they feel safe, where they're free of harm, but they also need to live in communities that are safe themselves, that are free of community violence, police brutality, and so many other things that are affecting our kids and communities. They also need stability in their relationships and within their environments. So stability, they need relationships that are predictable. They need relationships that are consistent in their lives, that support their development, but also the environments that provide that as well. So consistent things like childcare that they're able to count on, and that those are provided in a high quality fashion. And then finally, the idea of nurturance that we all need. We know that through the years, we've learned so much about the importance of parent-child attachment, the importance of serve and return relationships on the biology and neurodevelopment. And so we need relationships that are attuned to a child's developmental needs, meeting children at their developmental stage that they're at. But we also need environments that do that as well. We need child care centers that can foster the types of development in a developmentally appropriate way, so children have the opportunity to explore their environments in developmentally appropriate ways. So really, this is what we would hope for all kids, for all families, are these safe, stable, nurturing relationships and environments. And this brings us to the Essentials for Childhood framework. So this is really the steps that states, communities can take to implement a vision for safe, stable, nurturing relationships and environments. And they really have four broad goals that I'm going to talk about here in turn. The first is around building awareness and commitment around the need for safe, stable, nurturing relationships and environments. What they say is that what this requires is we need to build partnerships around a common vision, whether it's in our community, whether it's at a state level, but we need to not be working at opposition to others who are working in the same space. This forces us to partner with each other, as well as not just thinking about all of us who sit in the same rooms, we talk about the same issues all the time, but how do we engage what we think about as the unusual partners? How do we engage the business sector? How do we engage the media as partners, as critical partners in this work that we do? So we need to build awareness, we need to build commitment around the shared vision for safe, stable, nurturing relationships and environments. And we need to build the types of partnerships, including the unusual partnerships that don't already exist in our communities. Number two, we need to use data. I spend much of my time as the Chief Research and Strategy Officer trying to understand what the data tells us. And so what the CDC suggests is that if we want to promote safe, stable, nurturing relationships and environments, we need to use data to understand where are we doing well, where do we need more support. If you haven't looked, I think Kids Count is a great resource to understand kind of state distribution of the well-being of kids and families. And so, this is one great source of data to look at. There's many great publicly available sources of data, birth records, emergency room data, but we also need to understand what data we don't have. And just as we talked about the need to build collaborations and articulate a vision, we also have to understand and advocate for the types of data that we need to answer the questions that we have in order to make the evidence-informed decisions for program and policy implementation. Next is the idea of norms change and implementing evidence-based programs. We need to think about the societal norms that either promote health, well-being, and thriving of communities, or that hinder and get in the way of thriving communities. At the end, I'm going to use the example of universal home visiting as one of the potential ways that we can think about changing societal norms around the idea of families accepting help and really addressing the stigma associated with things like mental health services, substance abuse services, as well as the receipt of supportive services like home visiting. And then finally, we need to address policy. That's both policy at a federal, state, and local level, but also organizational policy. I'm going to talk about a few of the strategies, I think nationally and at the state level, that hold promise. But as organizations, we also have to think about how we create the types of environments for our employees that we would hope for the kids and families that we work with. So how do we implement the types of family-friendly policy, flexible work schedules, paid family leave, being able to make sure that parents have the flexibility that they need to provide for their children emotionally, but also financially. So again, what this is all culminated on is the recommendations from the CDC through their technical package around the key strategies and approaches that are backed by the evidence that hold the most promise. And what the CDC recommends is that the strategies that hold the most promise for preventing child abuse and neglect really center around, first and foremost, strengthening economic supports for families. That is, strengthening household financial security and implementing family-friendly work policies. They also talk about the needs for norms change, early quality care and education, as well as skill enhancement through many parenting programs. And I'm going to talk about a few of these here in just a minute. So where should we go? As sort of the concluding 15 minutes or so of my time, I want to talk about some potential directions that we can go as a field. I'm going to talk about really getting to addressing some of the root causes. This is where we talk about, enhancing economic supports for families, addressing institutional and structural racism, and really addressing many of the root causes that are affecting so many individuals and so many communities. talking some about the idea of norms change using the example of universal home visiting, and then talking about the issue of child sexual abuse prevention. But I have to acknowledge the moment that we're currently in. We're in the midst of a global pandemic. Listening this morning, rates across the country are continuing to rise. So many families are being affected by COVID-19, be it through losing a loved one, knowing of someone who has passed away, caring for someone who is dealing with COVID, or the many economic fallouts that have occurred since COVID. We've also seen incredible racial and civil unrest in the country, and calls for addressing institutional and structural racism, as well as the many natural disasters that continue to ravish the country, be it hurricanes in the Gulf Coast or wildfires that hit hard on the West Coast this summer. Dr. Wendy Ellis has been really helpful, I think, in pushing the envelope for the field and thinking about how do we talk about and think about addressing many of the root causes of adverse childhood experiences. And she uses this graphic to make the point that much of what we spend our time talking about are adverse childhood experiences. In my work, I oftentimes talk about the issue of child abuse and neglect, but she says, look, if we think about adverse childhood experiences as representing the leaves of a tree, these are the things that are visible to us. In our work, it's what we hear about, it's what we think about and spend a lot of our time thinking about. But she says, you know what? If we're going to truly prevent things like child abuse, things like substance abuse, domestic violence, incarceration, we need to actually tend to the soil. We need to get below the surface and start addressing many of the root causes of these adversities, which we know from the science are really rooted in things like poverty, discrimination, racism, lack of opportunity that is so pervasive in our communities. We know that we must address the social and structural determinants of health. It's not just about saying we need to provide parenting education, but it's in saying that we need, from a public health perspective, public health means what we do collectively to ensure the conditions where all kids and families can thrive. It's that notion of changing the conditions in which kids and families live, which will allow us to address many of the root causes of inequality that we see in this country. Now, I had shown you the graphic earlier of kind of framing what we talk about in prevention, but that analogy can be extended a bit further. Because how I started my presentation assumes that all communities experience the world in the same way. And we know that that's not the case. We know that there are significant differences that communities experience in their access to care. Some communities have more access to care, while other communities do not have access to care. We also know that there's significant variability in the quality of care that communities experience. Some communities, was hearing a stat the other day about communities that have mental health professionals around the Chicago area. And one of the statistics was that some communities have 0 mental health professionals, whereas up north in many of the more white affluent communities, that per 1,000, there's upwards of 300 mental health professionals. So we know that there's differences in not only the access, but also in the quality of care that communities receive. And then finally, we also know that there's differences in exposure to risk across communities. We know, and many of you know, that so many of our communities have been exposed to high levels of risk, be it through lead or environmental factors. And so when we think about building a prevention system, we can't assume that all communities are created equal, that we have to be very intentional in our strategy to ensure that we're addressing this very fact that there's differences in access, differences in quality, as well as differences in access or differences in exposure to risk and opportunity. So as we think about the issue of policy, in the last couple of years, there's been a number of articles written to suggest that policy, specifically increasing economic supports and family-friendly policies for families, actually reduces child abuse and neglect. The refundable version of the earned income tax credit has been shown to reduce hospital admissions for abusive head trauma. Looking at the state of California, who implemented paid family leave in the early 2000s, they too have seen significant reductions in hospital admissions for abusive head trauma. Work on the issue of minimum wage. We see that for every dollar increase in minimum wage, we see a significant reduction in child abuse and neglect. And that same trend rings true when we look at Medicaid expansion. We see significant reduction of child abuse and neglect for states with Medicaid expansion compared to those without. Now, if you haven't already, I would highly encourage you to follow the work of the Prenatal to 3 Policy Impact Center. They're doing some fabulous work on trying to track state level policy as it relates to many of the policies that I just mentioned, but also some other policies that support children and families. I just pulled this to highlight a couple of the areas that I had just talked about, specifically around paid family leave in Indiana. It appears that there's been some work in Indiana, at least around providing paid leave for state employees, but it provides room for us to think about ways in which Indiana could really think about paid family leave at more of a state level. As well, the idea of minimum wage, looking at the levels of minimum wage and some of the progress that has been made or not in the state of Indiana. Again, this is the Prenatal to 3 Policy Impact Center's data that they've looked at the state minimum wage, the cost of living, and other factors, and has been tracking legislation in the state of Indiana for a couple of years. And then finally, the issue of the state earned income tax credit, suggesting that the state earned income tax level is slightly lower than the 10% federal level, and really suggesting that there's still a eligible population in the state of Indiana who otherwise is eligible for EITC, but do not otherwise claim their EITC benefit. And so I oftentimes say that it's this gap that to me is some low-hanging fruit for us to think about really closing that gap in the earned income tax credit, because it's a policy that's already in place. We're not having to go trying to get something new on the books. It's just closing that gap and ensuring that all folks who are eligible for it are taking advantage of it. Idea of social norms, changing societal norms. I love to show this set of pictures because I can remember a time when planes had a smoking and non-smoking section. When I talk to my mom about early days of driving, she reminds me of times where she used to like to sit in the back window of her car and wave at the cars coming up behind them. These are all areas where, through significant advocacy and norms change and policy work, that we've been able to shift the ways that we think about things like smoking in public places, as well as seatbelt use. And I'm hopeful that there's many areas within our field, things like corporal punishment, areas such as social norms around receiving early supports. These are things that I think we can change the societal norm on. And hopefully someday my 2 daughters will be looking back and remembering a day where we actually had so many cases of abuse and neglect because we've done the types of work, we've changed the societal norms, so it's not a problem when they're ultimately raising their children. So I'll use the example of home visiting and the idea of changing societal norms. When we look at some of the data that comes out from McVie-funded programs, some of the evidence-based home visiting programs, what they suggest is that at a national level, there's approximately 18 million families that could benefit from a home visiting service. Yet just over 300,000 families across the United States actually receive one of those services. There appears to be a huge gap between the need and the actual families that are getting supports. Now, that could be explained for a lot of reasons: lack of funding for programs, lack of access to programs, lack of location of programs in areas where families actually need them. All of those things could be contributing to this gap, but I will argue that societal norms around the acceptance of these services likely are contributing to those low numbers. Before I came to Prevent Child Abuse America, I was on faculty at the University of Montana in the School of Social Work, and I worked closely with our city county health department. And in the county, we had a universal referral system for home visiting services. Every family that gave birth in the hospital was offered a home visiting or a call from a home visiting nurse. What we saw is about 3/4 of the families actually gave consent to be contacted by a home visitor. Yet of those families that gave consent, very few actually received a face-to-face visit. And so we wanted to understand why. So we did some interviews with new and expecting parents to understand, why is it that they're potentially not accepting these actual services? And our findings were so helpful. First of all, parents talked about the issue of trust. They said, listen, I don't want to meet a stranger in my home for the first time. I would feel much more comfortable if I could meet somebody on neutral ground, if they came to the hospital to meet me. And so what we learned from these interviews is we need to think long and hard about these issues of trust that families have. How can we think about meeting them on neutral ground? How can we think about engaging them in the hospital before we're asking to come into their homes? The next thing we heard about was the idea of home visiting as a form of government overreach. One of the interviews that stood out to me and likely will stand out to me for the rest of my career, one of the mothers that I talked about home visiting as a form of cultural imperialism. She said, home visiting is a way for the government to come in to tell you how to raise your kids. So as if we think about, why is it that some families do or do not receive these supportive voluntary services, if a portion of the population is really seeing this as a strategy of trying to tell you how you need to raise your kids, it helps us explain why it is that we're potentially only reaching a portion of the population who could benefit from these services. Almost universally, what we heard from families was, I don't want somebody coming into my home because I'm afraid they're going to send me to Child Protective Services. I'm afraid they're going to take my other kids. I'm afraid if my house is dirty, if I've got laundry, if my house stinks, they're going to take my kids. A slight bird walk: when we were pregnant with our second daughter, the first thing I did when we were in Missoula is called the city county health department and asked for a public health home visiting nurse, because the one thing we learned by having a first child was that for the second, there was a lot that we didn't know. What do you think it was that my wife did every night before our public health home visiting nurse came to visit? You're correct. She cleaned the house. Why did she clean the house? Because she was afraid if the house was dirty that we would be reported to Child Protective Services. As a field, we have to take this into account when we think about the gap between the families in need and the families who are receiving services. If there is fear about child welfare intervention, it helps us understand why families might be saying no to our services. And then last but not least, families were concerned about this idea of judgment. One woman said, I don't need a nurse coming into my home with a clipboard, checking off boxes, telling me how it is that I'm a bad mother. She went on to say, as a new mother, the world already feels like it's judging you, whether or not you breastfeed, if you're going to decide to circumcise your child. These are all ways in which the world very early on starts to judge new mothers and new families. She said, I don't need somebody coming into my home telling me that I'm a bad mother. for our purposes today, as we think about this issue of societal norms and why it is that people do or do not engage in our services, I think these might help give indication for opinions and beliefs that the general public holds about these otherwise voluntary supportive services. So there's a lot of work that we need to do to try to shift the narrative, to try to change the societal norm, to make this universally accessible. I had shown this earlier, a piece by Dr. Deborah Darrow, who's really been advocating for the need for a system of universal care and support for families in this country that spans the developmental continuum. We often say that children's needs do not end at age 3 or age 5, they continue on. We need to build a universal system of care and support that is coordinated across the developmental continuum so kids and families can transition through system. And it's built upon this idea that all families need support. The timing, the type, and the quantity of services will differ, but it's a belief that all families need support. And one of the promising strategies that we see that we think holds promise in decreasing much of the stigma associated with receiving support is family resource centers. Family resource centers have been shown to actually decrease reports for child abuse and neglect. And largely it's believed because they're embedded within communities. They're non-stigmatizing, they're offered to everyone in a community. You don't get referred there necessarily because problems are happening. They're there for all families, and they provide the types of supportive services that kids and families need to thrive. And finally, looking at this area of child sexual abuse prevention. As a field, I think we've done a lot to think about how it is that we teach kids about protecting themselves, starting to raise the awareness of adults and community members about their role in protecting kids. I think there's a lot that we can continue to do as we think about policies and youth serving organizations. Some of the updates that the CDC is doing to their guiding document, I think will be helpful. I think as we look at policies for providing education in schools, we need to think beyond just training children. We need to think about training all personnel in schools. That's not just the teachers, it's the administrators, it's the people in the lunchroom, it's the professionals helping in the classroom, it's the janitorial staff, it's everybody that comes into contact with children, because it's oftentimes the child walking around in between classes, or the kid that's sitting in the front of the bus who's talking to the bus driver about what's going on in their life. We need to think beyond just training kids to thinking about really creating a form of training that trains all personnel who come into contact with children. There's much more that needs to be done in this area of online child sexual abuse, how it is that we not only think about the idea of decreasing images, but also doing some societal norm change that really shifts the demand for these types of images. And a lot of that has to do with social norms around masculinity, the proliferation of pornography. This all sort of goes into thinking about how we would shift the societal norm around child sexual abuse. I put up here also, there's many other policies. We're doing some work with the Enough Abuse campaign and the National Coalition to Prevent Child Sexual Abuse and Exploitation to do an environmental scan of state level policies for child sexual abuse. One of the policies, which we hate the name of, but it's called Pass the Trash. And this is one of the laws that states put in place that really stop the moving of educational personnel from one school to another when there's been a allegation of sexual misconduct. And it basically says that if somebody is dismissed from one district for allegations of sexual misconduct, that information can be disclosed when that person is going to seek employment in another school or in another district. And this really helps be able to make sure that perpetrators of child sexual abuse are not just necessarily moving from one district to the next. So I have tried to cover a lot in the last hour and 15 minutes or so about the field, about where we've been, about where we could potentially go. But this now becomes our opportunity to have some discussion, answer some questions. I always love hearing about initiatives that are going on locally for you, challenges that you are all experiencing in your work. I know Catherine's going to help. I know she's been monitoring the chat box, but let's transition this to being much more of a discussion at this point.
Thank you, Bart, and thank you so much for giving us so much to think about and to follow up on. Catherine, are you ready with the questions?
Yes, sir. So we have a question for the changing social norms. Why do you believe that ideas such as seatbelt wearing and not texting, for example, have become such social focus and publicized issues? However, the abuse and neglect of children seems to only be the focus for those in that particular field, but not as in society as a whole. And then in addition to that, how do you think that we can get to the point in which not abusing a child is as important as a social focus of not texting while driving?
This is a fantastic question. And I think when we look at the history of seatbelt use, we can't deny the fact that there was funding behind efforts to try to increase the use of seatbelt use. There was significant lobbying that was done specifically to change policy. And we were experiencing significant deaths. And I think that in our field, what we've scratched our head oftentimes about is when we look at the numbers of kids who are abused and neglected, and the federal data that I provided are only those kids who come to the attention of child welfare or child protective service agencies. So we know that the scope of problem is even higher. And that annually, 1,700 kids are determined to die nationally from child abuse and neglect. We've oftentimes scratched our heads as to why is it that our issue does not continue to get the support like areas such as public smoking or seatbelt use. And I think that it's complicated. I think that it goes back to discussions about child's rights and the rights of parents to be able to discipline their children in any way that they want. It has rights when you talk about the issue of corporal punishment. Advocates for corporal punishment oftentimes cite verses from the Bible, spare the rod, spoil the child. Parens patriae, the idea of parental rights over children. We haven't ratified as a country the UN Convention on the Rights of the Child. All of these suggest that we've continued as a country to grapple with children as individuals who have rights in and of themselves. And we continue to err on the side of parents' rights, of individuals making decisions that are best for their children, and trying to balance being able to allow parents the flexibility and autonomy to raise their children, and having a system that says within that autonomy, we're not going to allow kids to be harmed. And so I think we continue to struggle with that. The area that we're working in right now where this is a big issue is in the topic of corporal punishment. Currently, we're in the field with a survey that is assessing social norms at a national level related to the topic of corporal punishment. We've developed a survey to try to understand, how does the US population really think about this topic of corporal punishment? And I think that it's these types of findings that will allow us to understand, where does the general public sit on this? Where are there opportunities to correct misinformation? And where are there opportunities for us to use real targeted messaging to think about shifting the norm around the use of corporal punishment? So it's a great question. I don't have the answer for how we're going to do it. I think it's really wrapped up in our roots of kids' rights versus parents' rights, our failure to ratify, to ratify the UN Convention on the Rights of the Child. I think that contributes.
Sharon Pierce of Prevent Child Abuse Indiana has talked about ad campaigns focused on mandated supporters of families and children instead of mandated reporters. of child abuse and neglect. What do you think of this approach? And do you think it will help with the CDC's norm change goal?
Mhm. Well, I just have to say how lucky you are all to have Sharon Pierce doing work in the state. Sharon Pierce is a fantastic colleague. I know that she's taught me so much over the years. And this idea of mandatory supporting really came out of some writing from our executive director in Arizona, who said, what if we didn't just focus on this idea of reporting families, but instead saw our role as mandatory supporters? And so, one of the biggest questions we've received at the national office since the start of COVID is, what do we do about kids that we're concerned about? How do we help mandated reporters understand their role and place calls when they're suspecting child abuse and neglect? So, one of the ways that I respond is in kind of balancing our concern right now. We want people to understand their role as mandatory reporters. If they're concerned, we want them to place the call. But at the same time, we would like to see a fundamental shift in the way that we think about and talk about this idea of mandatory reporting. And I do think it will create the types of norm shift that we need. And that is that mandatory reporter training, in addition to including things like implicit bias training, really need to include this idea of, what does family need look like? What does it mean for a family to not have access to food, not have access to shelter, not have access to safe community resources? And instead of us focusing all of our energies on the risk management strategies of making sure we report families, what if we saw our role as saying, you know what, I'm really concerned about Johnny in our class. I've noticed he's been really quiet. I wonder what's going on for him at home, and I wonder if there's some way that we can reach out to the family to see how things are going, to see if they actually need any support. And so I think it's a fundamental shift on how it is that we train around mandatory reporting. So much of the emphasis on the trainings that are done are around the legal mandates that are different in each state, but it focuses so heavily on the legal aspects. And I think we have to do much more to message about family need, how we as advocates can support family need, which also brings up the issue of community resources. And, what I'm saying assumes that every family and every community has access to resources. But as I talked about in my presentation, we also know that not every community has access to resources. And when they do, there's variability in the quality of those resources. So we also need to simultaneously advocate that just as much as we need to train our professionals to support families, get them connected to services early, we need to make sure that the communities have these resources, so when families are identified, that they can actually receive help.
Bart, thanks so much for ending our workshop series with a solid bang. My personal thanks to a terrific planning committee. They've just been spectacular. Everyone on the committee has pulled together and we've been working on this since this time last year. But thanks so much to, particularly to our Zoom masters, Eric Bodker and Marshila Harris. Fabulous job. And also to our funders, Geminis Community Partners and the Service League of Northwest Indiana. And also finally to our community partners. You'll see some credits rolling shortly. Take a look at our community partners there. And finally, thank you to all of you out there who've been with us for this webinar series. We thank you so much for joining us, and we thank you for all you do for Indiana's children and families.